Hello and welcome to Askimo TV. I'm talking today to Dr. Matthew Wilson. Dr. Wilson is a consultant orthopedic surgeon at the Exeter Hip Unit at the Princess Elizabeth Orthopaedic Centre in Exeter. Hi, Dr. Wilson. How are you?
Very well, thanks, Joanne. Good morning.
Dr. Wilson, let's talk today about redoing hip replacements, including bone grafting. So occasionally hip replacements will need redoing. Why is this?
So most typically hip replacements need doing when they've worn out, and that can either be due to wearing out of the bearing surface or that the hip replacement becomes loose. And typically a hip replacement will become loose because the bone around it is removed. And that is can be in response to an inflammatory reaction to the wear particles formed in artificial hips. The other reasons why hip replacements might need redoing are if someone has a fracture of the bone around that hip replacement, or if that hip replacement becomes infected. The only way to really treat that infection effectively is to remove that joint replacement, treat the infection, and then replace the hip again.
What is involved in redoing a hip replacement?
Again, it depends largely on why that hip replacement is being redone, but essentially the old components of that hip replacement, so the socket and the stem down the femur, are removed, and any associated fixation materials such as cement or screws are also removed at the same time, so that you're back to a fresh area. And then the hip is reconstructed, and that can need bone graft, it can need extra metalwork inserted, it can need extra cables or screws to hold the bone together, and then the new implants are inserted into that patient's joint.
Tell me a little bit more about the bone grafting used in this revision.
So bone grafting has been used for many years in various joints, but it's really mainly used, I guess, in the hip joint. Various techniques have allowed it to be used very successfully. Because when a hip replacement wears out, commonly there is bone loss. And certainly in a younger person, the aim is to try and restore some of that bone stock, because with every hip replacement you do on that person, they will lose a bit of bone. And you can end up in a situation where you have no bone left to redo the hip. So particularly in Exeter, we have an interest in restoring bone. So taking bone from our bone bank, which is donated bone. When people have hip replacements, they donate their bones to the bone bank, and then we can use that as a transplant material effectively, and we impact it into the patient's own bone, and then over a course of time during the healing process, that bone is replaced with their own bone.
What is the recovery like after the revision hip replacement?
It depends a lot on how extensive the revision surgery is. For a very straightforward revision, the rehab can often be as quick and sometimes quicker than an original hip replacement, because that patient knows what to expect. But for a much larger revision, particularly with the use of bone graft, then we'll often take patients a lot more slowly, because the bone graft has to incorporate. So we may keep someone on crutches for 6 weeks, keeping some weight off that leg to allow the bone graft to incorporate and to allow the tissues to heal. But the recovery these days is pretty good, but it does depend on the extent of surgery.
And just to end off, what is the prognosis after revision?
Well, once again, it depends largely on what was done at the revision surgery, but our techniques of revising hip replacements have improved dramatically over the past few years, and we now have implants which we're pretty confident will last as long as the original hip. So I tend to quote patients 80 to 90% survival at 10 years for a revision surgery, whereas I may quote 95% after the first type of surgery.
Thank you, Dr. Wilson. Thank you so much for talking to me today.
That's a pleasure. Thank you very much.